So let's start with how the heart works. So the heart is essentially a pump which pumps blood around the body, and it has its own blood supply. So there are arteries which bring blood to the heart, which we call coronary arteries. We have two on the left side, one here called the left anterior descending, and one at the side called the circumflex, and the other on the right side called the right coronary artery. So all the blood returns to the heart through these two big veins. The heart pumps the blood out into the lungs where oxygen is applied to the blood, and then the blood returns to the heart, and then it pumps again, and then the blood leaves the heart through this big vessel here called the aorta. So one of the conditions which can go wrong is coronary artery disease that can occur, affecting the blood supply to the heart. So this is the coronary artery. Inside the coronary artery, and you can see in this coronary artery, it is filled with lipid, and on top of the lipid, a fibrous cap is formed. So this is what we call atherosclerosis or coronary artery disease. And obviously, as you can imagine, the blood flow through these blood vessels will be reduced because of the narrowings of the blood vessels in it. So if you have this condition, you can present with chest pain and shortness of breath. These are the most common symptoms affecting patients with coronary artery disease. A number of investigations we can do to diagnose coronary artery disease. So we can do a ECG. We can do this with you doing some exercise. So what we call a stress ECG and stress echocardiogram. We can do a coronary CT scan, which gives more detailed information on the blood vessels supplying the heart. And we can also then do a coronary angiogram. So typically we would start with just a normal ECG and perhaps exercise stress ECG. And only if that is abnormal or we're not satisfied with the results, and then we can go on to a coronary CT scan. And then if that doesn't give us the information we need, then we can proceed to a coronary angiogram. The reason for that is that the investigations get a bit more invasive further down. So we always start with the least invasive investigation, which is easiest to do and which will give us the information which we require. So this is an example of a stress ECG. So the ECG is done with you doing some exercise, and we can see if there may be a problem with the blood supply to the heart. As in this example, it shows that in one region of the heart, the blood supply is not adequate at peak exercise when the heart rate has increased, in this case to about 150 beats per minute. So if we find this sort of abnormality, then we can go on to a coronary CT scan. So this is an example of that. So to do this test, it is essentially a CT scan, but the difference is we inject some dye into a vein. And after that, images of the heart are taken. And this gives very detailed information about the coronary arteries supplying the heart. And from this, we can tell whether there's any narrowings or blockages in the blood vessels supplying the heart. If we are considering further intervention, like putting a stent in or going for bypass surgery, then we would need to proceed to a coronary angiogram. This is a bit more invasive because we have to put a catheter into an artery either in your wrists or in the groin, and then push this catheter up to the heart right here. You can see there's a catheter here, and then inject some dye directly into the coronary arteries. And then that shows it very well. So in this example, you can see this artery here, what we call the left main stem, is very narrowed. And then this artery, the front of the heart, this is actually the most important artery of the heart. You can see there's hardly any blood going through it because of very bad narrowing there. And there's also a very bad narrowing there. So this would be the a more invasive sort of investigation which we can do to diagnose coronary artery disease. So the aim of any treatment for coronary artery disease, firstly to improve your symptoms, because patients get very troubled with chest pain, what we call angina, or shortness of breath. Also more importantly, to improve your survival, to help you to live longer, and also to reduce hospital admissions, to reduce the need for you to come into hospital because of chest pain or heart attacks. There are several treatment options. In most cases, most of the time, coronary artery disease is not very severe. It is only a very mild disease, and most of the time it can be successfully treated with just medications. If the coronary artery disease is a bit worse, then we have the option of putting a stent in or putting a balloon in, coronary angioplasty. For more extensive coronary artery disease, then we can offer coronary artery bypass surgery. So various medical treatments are available, and there are various classes of medication. So, for example, we have the antiplatelet medications which should thin the blood down and prevent heart attacks, such as aspirin, clopidogrel, and ticagrelor. We have medications which will relax the coronary arteries and so improve the symptoms of chest pain or chest discomfort, such as the nitrates and calcium antagonists. And then we have medications which will improve your survival to help you to live longer, such as the beta blockers, the ACE inhibitors, and the ARBs. And of course, we have got medications to control the cholesterol, which is the main risk factor for coronary disease. So we have the statins as well. So this is the stent. If the coronary artery disease is worse, if you are still having symptoms with the medications, then we can put in the stent. So the stent is put into the coronary artery, and then it opens up, and then it pushes apart the narrowing to allow blood to flow through the coronary artery disease. So this is a very good treatment for patients who have one or two narrowings of the blood vessels supplying the heart, because it can then give symptom relief very effectively. For more extensive disease, then bypass surgery may be suitable. Essentially, bypass surgery is like building a new highway to bypass all the old roads. So, for example, this is the coronary artery, and in this case, there are a lot of narrowings and blockages involving this blood vessel of the heart, and also involving this blood vessel, and also involving this blood vessel. So if there's a lot of coronary disease involving multiple vessels, then bypass surgery is a better option. And typically we would take a blood vessel from under the chest wall and some from either the arm or the legs to then bypass all the areas of the heart which has the narrow arteries. So in this example, this artery is taken from under the chest wall and stitched onto this area, so that it bypasses this whole area, which is the problem area. And another blood vessel is taken from the arm or the leg to bypass this whole area. So you can think of this part of as the old road. This is the town where the blood needs to reach. So we've essentially built a flyover or bypass all the congested roads so that the blood can reach the area it needs to reach. It can reach the town. So the coronary bypass surgery has several aims to restore normal blood flow to the heart, to prevent further heart attacks, to improve your symptoms, and also to improve your survival. So which is the best treatment? So for very limited coronary artery disease, when the coronary artery disease is not too bad, for example, if it involves just one or two coronary arteries and it does not involve the artery in front of the heart, then medical treatment is usually very successful. But if you continue to have symptoms with medical treatment, then coronary stenting would be useful to improve your symptoms. Now, if you have more significant coronary artery disease, particularly if it involves the artery in the front of the heart and narrows it by more than 70%, then medical treatment is still needed. But in this situation, coronary stenting would be beneficial as well. For even more extensive coronary artery disease involving that main blood vessel in front of the heart, narrowing by more than 70%, and particularly if it involves multiple other coronary vessels, what we call multi-vessel coronary disease, then coronary artery bypass graft surgery is the best option. So there are various treatment options depending on the severity of the coronary disease. The difference between stenting and coronary bypass, stenting obviously would treat the lesion, the culprit lesion, but it treats only a single lesion. And also it does not protect against future lesions if it should happen. Whereas bypass surgery, because it bypasses the whole area which is at risk, it not only treats the culprit lesion, but it protects against future events as well. Because even if another part of this artery gets narrowed or blocked, it doesn't matter because that whole area has been bypassed. So that is an important difference between stenting and bypass surgery. And it is also the reason why bypass surgery is better if there is extensive coronary disease. But if there's limited coronary artery disease in one or two places only, then coronary stenting is by far the better treatment option. So talking about bypass surgery, it is nowadays a safe operation. For most patients, the risk of bypass surgery is about 1%. So 99% of patients have go through bypass surgery very successfully. The sternotomy wound, which we do to do the operation, is usually not a very painful wound. Most patients are okay with just paracetamol after a few days. Some will require stronger analgesia, and this can be provided if needed. Most patients will stay 2 nights in the intensive care unit and additional 4 to 5 nights on the ward. After a week, most patients can go home and they're quite okay. After 4 weeks, they can drive again. But the bone, the sternum, takes up to 3 months to heal completely. So patients should avoid carrying or pulling on heavy things for up to 3 months after the surgery. After 3 months, most patients will feel better compared to before the surgery. Now, even though you have had bypass surgery, the medications are still very important. So you still need to continue on the medications even after the surgery. So, for example, the antiplatelets to prevent blood clots, the aspirin is important. And nowadays we combine it with clopidogrel as well for up to a year. And then control of the cholesterol is important. So the statins are important. And of course, medications for the blood pressure and also for the heart, and control of diabetes is important if you are diabetic. And lifestyle changes or a healthy lifestyle is still important after bypass surgery. So regular exercise is important, a healthy diet, and definitely no smoking. Patients who go back to smoking after bypass surgery will run into problems in future. So we always advise patients not to start smoking again after bypass surgery, because then that will put the new bypass grafts at risk. So it's important to maintain a healthy lifestyle even after bypass surgery. If we compare bypass surgery and stents and medical treatment, then those who have multi-vessel coronary artery disease live the longest if they have bypass surgery. And this is one of the studies. There are numerous studies which have been published now. So this is one of them called the Syntax trial. And this looks at how long patients live after either bypass surgery or after stenting. So PCI is stenting, percutaneous coronary intervention. So this on the x-axis is the years, the number of years, and this is on the y-axis is the probability of death. So how many patients have died? And you can see the blue line are those who have had bypass surgery, and the red line are those who have had coronary stents. And you can see that over 10 years, those patients who have bypass surgery, less of them have passed away compared to those who have had stents. So those who have bypass surgery definitely do a lot better. They live longer compared to those who have had coronary stents if they have three vessel coronary disease, meaning three or more coronary vessels have got coronary disease. And then this is another study. This study combined all the studies which have been done comparing coronary stents against bypass surgery. And you can see there are about 10,000 patients have been studied. And over 5 years, you can see again, the blue line are those who had bypass surgery, and the red line are those who had coronary stents. And those who had bypass surgery, less of them have died at 5 years compared to those who have had coronary stents. So survival is better after bypass surgery in those who have multivessel or left main coronary artery disease. And the differences are even greater in patients who have diabetes. As we can see in this study involving 4,000 patients. So these are patients with multivessel coronary artery disease who are diabetic. And you can see here that at 5 years, those who had bypass surgery, less of them had died compared to those who had stents. So survival is better after bypass surgery, and this is even more evident in patients who are diabetic. So the take-home message for coronary artery disease, medical treatment is best if the coronary artery disease is not too severe. Coronary stenting can be considered for persistent symptoms with medications and for coronary lesions involving the artery in front of the heart. Coronary artery bypass graft surgery is the best treatment for more extensive coronary artery disease involving the artery in front of the heart and other coronary arteries. Bypass surgery offers the best survival and symptom-free survival, meaning survival without any symptoms of chest pain or breathing difficulties, compared to coronary stenting or medical treatment in multivessel coronary artery disease. The benefits of bypass surgery is greatest in those with more severe coronary artery disease, abnormal function, and diabetes. I'd like to thank you again for joining us today, and thank you to CVSKL and to our supporting partners for arranging this webinar. I hope it's been useful and interesting, and I will be happy to answer questions. Thank you.